Hello friends, welcome to Creative Medicine. In this lecture, we will learn about treatment of choice for bipolar disorder is antipsychotics, electroconvulsive therapy, and lithium carbonate can be used. So for bipolar therapy, bipolar disorders, we can use lithium and antidepressants because lithium can stabilize the mood. Antidepressants are used for depression. So for bipolar disorder, which contains two components, mania and depression, we can use lithium and antidepressants. In cases of severe mania, which are not responding to these medications, or in bipolar depression with high suicidal risk, in such cases, electroconvulsive therapy can also be used. Thank you and thank you for watching.